the past 15 days, I mean, like we have been in hospital. So my father had a chest pain last 15 days back, and then he thought it was a regular gastroenteritis problem. So ignored for the night, and then he suffered for 15 to 20 minutes. And later the next day, when we approached a family doctor of ours, Dr. Nagasuresh Garu, who is from Kurnool. So when we went there, he had some doubts by seeing his condition physically, and then he suggested to go for a series of tests. We ran through some tests, echo was done, and then ECG was done, and then finally he thought of going for an angiogram too. So after that, they concluded that there was blocks in his heart, and then one main artery was blocked. There was 70 to 80% of block was there, and then they suggested like it would be better to go for a surgery as soon as possible. So after that, we took advice of many doctors, and like our brother himself was a doctor, and then we asked him for support. He advised us to, approach some doctors. First we approached Dr. Kondal Rao, who was a thoracic surgeon too, and then he suggested like there are two ways of operating this block. So one was bypass, which can be done from front side by cutting the bones and everything. So, and another one was side, which can be operated from side, minimal invasive surgery. So they suggested like if we go for a side operation, side surgery, there are chances of less chances of success, right? Because the block was not visible in the angiogram, and then they felt like it would be good if they do the surgery from the front side. So again, after that, we went to another doctor for a second opinion, and he also suggested the same. Whatever the Dr. Kondal Rao suggested, he suggested the same. And after that, we went back to Kurnool again, and then we spoke to Dr. Nagasuresh. And then Dr. Nagasuresh, who was a family member of my father's, so he suggested like there is one doctor, Vishal Khante is there, who used to work with them. They were both colleagues, I guess. So he suggested like this can be done by the operating from the side, that is minimal invasive surgery, which is operated by only 4 doctors in entire AP and Telangana, and Dr. Vishal is one of them, who has a very high success rate. So we came to Kamineni after consulting with Dr. Nagasuresh. Then after coming to Kamineni, we met with Dr. Vishal, and then he saw the reports earlier, and he was in continuous contact with Dr. Nagasuresh, and Pawan was there. Thank you, Pawan. He was contacting, he was in continuous contact with us, guiding us, how to come to the hospital and where to meet Dr. Vishal and everything. He was there from day one from Kamineni when we have come for the opinion over here. So after that, Dr. Vishal has explained, how the surgery goes and what is the present condition of my father. So he explained things, and as every surgery has a risk assessment, so he explained about the risks too, and also the success rate is very high. So after much confidence, he has given us the confidence like we can go for the surgery. So then with his help, we have admitted in the hospital under the EHS category. Since my father was a pensioner, the EHS Aragyasri was applicable, and then that was done. So after a few days, we waited for 2 to 3 days for the approvals to come. Once the approvals were in place, the surgery started on Monday morning. So the surgery was successful, and then on the same day he was moved to ICU, and then the tubes, he was there on ventilator for a few hours. So after that, they have taken out the tubes, and everything was good. He was responsive, and then I think this doesn't happen so easily. I have seen some patients or cases where after the surgery is done, the patients get into consciousness after next day, I mean like after 24 hours. But here in my father's case, it was a quick, he has, I mean like he came into consciousness after 3 to 4 hours after the surgery went, and then he's good now. I mean like then the very next day, he is a person like who doesn't stay in one place. He goes for continuous walking and everything. Wherever he goes by walk. So he has a habit of walking early in the morning. So I think the next day he was walking early in the morning in the ICU itself. So that is great, and then we are thankful for the doctors and then support and everything.